Well, our top story, the vaccine drive will open up from Monday. Anyone above the ages of 60 or above 45 years and with existing illnesses that makes them more vulnerable to COVID will be allowed to sign up to receive the coronavirus vaccines at government as well as private hospitals. All this begins from the 1st. Now, doses at the government centers will be free, but at private hospitals, they will be allowed to charge for them. And NDTV has learned that it's expected to cost around 300 rupees per dose. NDTV Sonal takes us through all the details that are available.
The biggest piece of news in all households across the country now is that finally it is our turn, and starting from the 1st of March, people above the age of 60 and those with comorbidities above 45 will be eligible for the vaccination. Also, this is the second phase. That means private hospitals as well have been given the license to do it, but in that case you will have to pay for the vaccine. But just about 4 days to go. That's pretty much what we know from the government about the rollout process. But don't get anxious. NDTV has spoken with top sources in the health department, and this is what we have gathered. First up, the cost of the vaccination. So currently the vaccine costs between 200 to 295 to the government. So roughly that's the range we are looking at after covering some overheads like syringes and human resource. The vaccines in private hospitals are likely to cost around 300 rupees. And also, like in the case of COVID testing, the government of India is likely to cap the pricing as well. So private hospitals can charge less than 300 rupees in cases, but not more. Next up, who gets this vaccine? So if you are above 60, you automatically qualify. But for those with comorbidities above 45, sources tell us that deciding your eligibility will be a one-page medical document. One page that the government will make soon public to all of us, and it will have a list of 20 diseases. You simply have to tick yes or no, saying whether you fall in that severity category or the risk zone. And then you have to get that signed by a registered medical practitioner. Upload it on the app and your work is done. But how will you get the slot? When will your turn come? Well, for that, speaking with top sources, I figured out that they indicated that it would be something like booking a railway ticket. That means first come, first serve. And like you have to log in on the IRCTC to book your ticket, you will have to log in on the co-win app in this case. And since there have been several glitches reported in the past as well about the co-win app, walk-ins will be allowed. But so far we are told only if the jabs remain unused at the end of the day. Also, private hospitals will only get specific number of doses, and to ensure that there is no black marketing, no jumping of the queue, they will have to upload the details of the individuals that they are vaccinating on the co-win app. The government will then match it up with their own electoral list to get all those details. Now, registrations will begin once the co-win app is declared open, and the date of that is still awaited. And which brand of vaccine will you get? That crucial information the government currently not speaking about. On the whole, we are learning that this phase will be quite inclusive. So get your hints right there. Sonal Mehrotra Kapoor, NDTV.
Those over 60 and those with diseases like diabetes and hypertension will finally get vaccinated from the 1st of March.
Now, this vaccination second phase will start from Monday the next, 1st March 2021. So, 60 plus anybody and 45 plus with comorbidities will be given vaccines.
एक बात मैं बहुत विनम्रता से कहना चाहूंगा, हम लोग अधिकांश मंत्रियों की अपनी अपेक्षा है कि हम लोग पेमेंट करके लेंगे, ये हम आपको बताना चाहते हैं.
The public welcomed the government's move. 67-year-old Rakesh Dang and his 65-year-old wife had been waiting to get vaccinated. Both are patients of hypertension and have spent most of the last year inside their house.
The vaccination to be available at a proper healthcare center, a proper hospital, where the COVID requirements are met, distances are maintained. I would never go to a place which is crowded.
But are India's systems ready? Officials say that modalities of the public launch of the co-win mobile application and website are being finalized. The government is already uploading bulk data from electoral rolls, and there will be different options for self-registration and the means to upload photo identity documents like the Aadhaar card, driving license, PAN card and so on.
It's not only the COVID app, we are thinking of linking it with Arogya Setu app. The government is already in that process of thinking, and also there would be some people who are not app savvy also. So there, our healthcare machinery comes into picture, which will be helping them.
The move towards wider vaccination comes at a time when India has been seeing a surge in daily cases. The centre has also rushed central teams to 10 states which are seeing a surge in daily cases and has written to 7 states, Maharashtra, Kerala, Chhattisgarh, Madhya Pradesh, Gujarat, Punjab and the Union Territory of Jammu and Kashmir to increase the proportion of RT-PCR tests. Also, those coming from Maharashtra, Kerala, Madhya Pradesh, Punjab and Chhattisgarh to Delhi will need a negative RT-PCR report to enter the city.
There is a rapid increase in cases in central Maharashtra, eastern and central Maharashtra. This is somewhat worrying because it may be that a new wave of pandemic is starting.
The government had earlier said that there are 27 crore people in the above 50 and below 50 age group with co-morbidities, and the government aims to vaccinate them by July 2021. In New Delhi, this is Sukirti Dwivedi for NDTV.
So the vaccination drive opening up from Monday, and this as cases are now rising. Let's take you through the states that reported the top number of cases. And in Maharashtra, 6,218. In Kerala, 4,034. Tamil Nadu, 442. In Punjab, 414. Karnataka, 383. Now, the top 5 states seeing the highest percentage increase in cases was Kerala with 0.33, Maharashtra with 0.29, Punjab with 0.22, Gujarat 0.12, and Madhya Pradesh with 0.11%. Now, Maharashtra reported a significant jump in new COVID cases and fatalities on Wednesday, continuing with the rise that started 10 days ago. A total of 8,807 new cases, that's the highest in 129 days, was added on Wednesday. So that's a big jump in cases, the highest in 129 days. Now, schools reopen in Telangana, but a very different type of schooling post the lockdown and finally reopening after 2020. There are customized seating arrangements. The number of students to each class has been limited, and it has to all be planned out in detail. And a parent consent in writing is mandatory.
First day of physical classes for middle school students in Telangana. Hardly any 6th, 7th or 8th class student turned up. Students were taken by surprise. So was the school, as they had to do a lot of preparation to allow students to attend. Customized seating arrangements, number of students to each class to be planned in detail, and parent consent in writing is mandatory.
పెరిగిన స్ట్రెంత్ అంటే 6th to 8th కూడా వస్తుంది అంటే వాళ్ళకి అకామిడేట్ చేయడానికి, తర్వాత అంటే టాయిలెట్స్ కానివ్వండి, మిడ్ డే మీల్స్ మెయింటెనెన్స్ కానివ్వండి, ఇవన్నీ కూడా మాకు ఛాలెంజింగ్గానే ఉంటుంది.
Parents will be positively, they'll respond, I think so. If they are coming, we are also welcome, but only thing is accommodation only, it's difficult for us.
These are students in fact of class 9 and 10, classes for who in fact began on the 1st of February. Here if you just take a look at the board, you can see that in the English medium the attendance is in fact about 75%, I must say. Out of the 46, 32 have come in, 35 to 27 have come in. The teacher wearing face shield as well while she is addressing the students. The classes have also been done in such a way that the social distancing between the children is maintained. This is of course a government school, and actually the attendance has been better in government schools as compared to the private schools, because many children are also coming from backgrounds where digital learning may actually be a challenge. The Hyderabad School Parents Association says the government has come under pressure from private schools that want schools to reopen so full tuition fees can be collected. The decision comes even as the state government has decided not to release daily reports of COVID testing and positive cases and instead release it once a week. As they say, there has been no spurt in cases in Telangana. Telangana has in the past been accused of hiding COVID figures by not testing enough. The High Court in fact had to force the government to put out detailed reports every day. With the spurt in cases in Maharashtra and borders open on all sides, there is now reason for concern. In Hyderabad, with camera person Nagaraju, Uma Sudhir, NDTV.
In other news now, the Motera Cricket Stadium will be called the Narendra Modi Stadium, a part of a larger sports complex named after Sardar Patel. But the question, however, is should public spaces in India be named after political leaders, and that too a serving Prime Minister? This is a reality we've had for decades. Why is it that we don't have cricket stadiums named after cricketers, while there's no dearth of them named after political leaders? That's just one of the many questions that is now being raised.
As top VIPs, including the President of India, gathered in Ahmedabad for the opening of the world's largest stadium, a sudden twist in the tale. At the touch of a button by the President, the curtains parted to reveal the Prime Minister's name. The Sardar Patel Stadium in Motera, now called the Narendra Modi Stadium. In attendance was the Home Minister, who said the state-of-the-art stadium was Mr. Modi's dream.
प्रधानमंत्री नरेंद्र मोदी जी गुजरात के मुख्यमंत्री थे तब देखा हुआ उनका सपना था, जो न केवल दुनिया का सबसे बड़ा क्रिकेट स्टेडियम है, दुनिया का सबसे बड़ा स्पोर्ट्स स्टेडियम है, जिसका नाम आज हमने हमारे देश के प्रधानमंत्री नरेंद्र मोदी जी के नाम से रखा है.
Many asking, however, if even the government media knew about the change beforehand. A tweet from Prasar Bharati about 5 hours before the event said the President would be inaugurating the Sardar Patel Stadium. 4 hours later, Prasar Bharati called it the Modi Stadium.
The presence of both the President of India and the Home Minister at the unveiling of the world's largest cricket stadium was a big news moment for the media. But its renaming from Sardar Patel Stadium Motera to the Narendra Modi Stadium came as a complete googly for everybody.
The government went on the defensive, claiming only the stadium has been renamed, not the sports complex.
मोटेरा स्टेडियम का नाम बदला है, वो परिसर वल्लभ भाई पटेल सरदार पटेल ही है.
Other controversies surfaced. The Congress questioned why the two ends of the stadium were named after corporates seen as close to the government. Regardless, the optics were clear. With the Gujarat-led BJP in power in Delhi, the center of cricket's gravity shifting to the Prime Minister and Amit Shah's home state.
कोई भी अंतर्राष्ट्रीय खेल स्पर्धा करनी है, चाहे कॉमनवेल्थ गेम करने हो, चाहे एशियाड करना हो, चाहे ओलंपिक करना हो, अहमदाबाद 6 महीने के अंदर तैयार होकर खड़ा हो जाए. इस प्रकार का स्पोर्ट्स इंफ्रास्ट्रक्चर आज यहां पर बनने की शुरुआत हुई.
Now, election news, and as Bengal hunkers down for the mother of all electoral battles, Mamata Banerjee launched the Trinamool's war cry, Khele Hobe. She said, validating a Trinamool anthem that has already gone viral. It loosely translates into, come on, let's play. In Bengal's case, it has to be football, and she has declared herself goalkeeper. The question is, will it be a gentleman's game to the end?
Khela hobe, khela hobe. রাজনীতিটা কি খেলার ময়দান?
There is a tug of war over who started it all. Was it this veteran Trinamool leader from Birbhum, or this Trinamool young Turk from Kolkata? Some even trace the slogan back to Rabindranath Tagore. Whatever the origin, the slogan Khela Hobe, which loosely translates to come on, let's play, is now Trinamool's war cry, or anthem if you will, vigorously validated today by Mamata Banerjee herself.
Khela Hobe, তাহলে খেলা একটাই হবে 21 সাধারণ নির্বাচনে. খেলাটা কি একদিকে সিপিএম কংগ্রেস বিজেপি থাকবে আর একদিকে তৃণমূল কংগ্রেস থাকবে.
BJP has taken the football idiom forward. If Mamata Banerjee is goalkeeper, BJP has the best strikers, they say, who know how to net the ball. Or they are wondering, is Khela Hobe a threat?
খেলা হবে, খেলা হবে. রাজনীতিটা কি খেলার ময়দান? আমরা অবাক হয়ে যাচ্ছি, কিসের খেলা হবে? আপনারা কি চাইছেন রক্তের হোলি খেলতে? তিনি যদি গোলরক্ষক হন, আমরা বড় বড় স্ট্রাইকার আছি মাঠে, কিভাবে গোল দিতে হয় জানি.
The CPM has hit back with a parody of its own, Tumpa, and that has gone viral. Bengal is rolling up its sleeves for the mother of all World Cup matches. Big question, will it remain a gentleman's game? In Kolkata, Mamata Banerjee, NDTV.
And at a rally yesterday, bluff master, Dangabaaz and liar are some of the words that a very angry Mamata Banerjee used against the BJP and the Prime Minister.
একটা পার্টি একজন দানব আর একজন দৈত্য এত বড় সাহস মা বড়দের আজকে কয়লা চোর বলছেন আর কয়লা চোরদের নিয়ে পকেটে পুষে আছেন এত ভাউতাবাজ এত মিথ্যেবাজ এত দঙ্গবাজ এত প্রতিহিংসাপরায়ণ পার্টি সারা পৃথিবীতে কোথাও নেই ট্রাম্পের দেখেছিলেন তো ট্রাম্প আমেরিকার প্রেসিডেন্ট তাকে গিয়েছিল জেতাতে মানে নিজের কিছু করবার ক্ষমতা নেই গেছে ট্রাম্পকে জেতাতে ট্রাম্পের যা হাল হয়েছে ওনার হাল তার থেকেও খারাপ হবে মনে রাখবেন হিংসা কখনো মানুষকে ভালো উপহার
With that, time for us to slip into a short break. Coming up on the other side, will Nirav Modi be extradited? We'll get you all those details. Welcome back. A court in London will today pronounce its verdict on the extradition case that India has filed against fugitive Nirav Modi. The luxury jeweler has been in jail in London since March 2019 following an arrest after an Interpol notice was issued in the Punjab National Bank scandal, termed as India's biggest bank fraud. He fled the country days before news broke of the PNB reporting of fraud to the tune of 14,000 crore rupees by Nirav Modi and his family members in connivance with some bank officials in Mumbai. On behalf of the Punjab National Bank, officials in question fraudulently issued letters of undertaking during the year 2011 in favor of Nirav Modi without following due process. The CBI and Enforcement Directorate have charged him of money laundering and have been pressing for extradition for investigation to India. But that time for us to slip into a short break. Coming up on the other side, we'll tell you about Rahul Gandhi's visit to Kerala. The BJP hit out at Rahul Gandhi's comment comparing politics in the north and south. BJP President JP Nadda tweeted, in the south he is spewing venom against the north. Divide and rule politics won't work. People have rejected this politics. Look at Gujarat. Now, senior Congress leader Kapil Sibal balanced criticism of Rahul Gandhi's remarks about Kerala voters with defending his colleague from the BJP's hawkish attacks.
जहाँ तक हिंदुस्तान के मतदाता का सवाल है, चाहे वो नॉर्थ में हो, चाहे वो साउथ में हो, चाहे वो वेस्ट बंगाल में हो, चाहे वो महाराष्ट्र में हो, कहीं भी हो, तो मतदाता होता है ना। हर मतदाता जहाँ भी वो होगा, वो समझदार मतदाता है। उसको मालूम है कि किसको वोट देना है, क्यों वोट देना है, किस राजनीतिक दल को वोट देना है, किस प्रत्याशी को वोट देना है। मतदाता को सब समझ है, चाहे वो साउथ का हो, चाहे वो नॉर्थ का हो।
Now, the vaccine drive will open up from Monday. Anyone above the age of 60 or above 45 years with existing illnesses that makes them more vulnerable to COVID will be allowed to sign up to receive coronavirus vaccines at government as well as private hospitals from the 1st of March. Now, doses at the government centers will be free while private hospitals will be allowed to charge for them. And NDTV has learned that it's expected to cost around 300 rupees per dose. Now, the AIMS chief, Dr. Randeep Guleria, spoke to NDTV and he said it's important to quickly scale up the vaccine drive to combat the spread of COVID, especially with cases now going up.
The Maharashtra situation, the numbers have just come in. What does this indicate to you? And, you know, I mean, are we seeing this going up very sharply? What is your thought on the numbers?
So I think this is a cause of concern because there is a spike in the number of cases, and this has been seen for the last few days, and therefore the trend is not very encouraging. And therefore I personally feel we need to be very aggressive. We need to sort of literally nip it in the bud, because the situation in our country is good, but we've seen globally that this situation can change very quickly. And therefore, in terms of testing, tracking, isolating, developing containment zones, and possibly also trying to vaccinate as many people as possible in that area like UK did, we need to develop strategies in that manner so that we're able to contain the spread of infection and make sure that it doesn't spread to the rest of the country or to other parts of the state.
And so, Doctor, is that why we have speeded up the process of vaccinating different categories of citizens now, because of these numbers? Not just in Maharashtra, it has to be said, a few other states as well.
Yes, that could be one of the reasons, because we don't have an effective antiviral drug right now. What we have currently available is a vaccine which is effective, and it will help to at least decrease serious illness and mortality, and that will bring down the case fatality rate. And it will also help to break the chain of transmission.
Right.
So I think it's very important for us to start vaccinating as many individuals as we can, because as we're seeing in Maharashtra, we don't want the situation, a similar situation to develop in other states. And one of the ways to really prevent that is by vaccinating as many individuals as we can. This is a strategy which UK also adopted when they had a huge surge in the cases in the southern part of England.
So that is really my first question now. When will the process of administering vaccines to 60 plus citizens and 45 plus citizens with comorbidities begin? That's my first question.
So this process should start, I think, the first week of March, as early as possible. It may be even on the 1st of March itself to some extent. It will possibly start at a slow pace, and once we have more and more vaccination centers coming on board and having the ability to do it, it will become a bigger movement, a larger movement, and I'm sure there will be a lot of participation of the private sector, which will really increase the number of people who can be vaccinated on a given day.
Doctor, how do you define comorbidity? People above 45 with comorbidities can get administered. So what is a comorbidity?
So comorbidities are, there has been a group which has worked on this and tried to develop what should be comorbidities, especially looking at those illnesses which could lead to a higher chance of that individual having landing up in hospital or dying because of COVID-19. So you have large number of comorbidities. Some of them may not be a risk factor for having severe death, but there are others which could be obesity, which could be diabetes, which could be heart disease, which could be cancers, which could be also people who are let's say having disabilities, which can lead to high chance of respiratory infection, or those who are on drugs which lead to a lower immune response, and we know that that can lead to a more serious pneumonia or serious COVID infection. So based on a criteria, you could be in that category and you could go and get yourself vaccinated.
What proof of comorbidities need to be produced, and by who?
So for comorbidities, you don't need to get any tests done. If you have your records which show that you have got comorbidities, you can go to any GP or any doctor, either in the government sector and private sector, and based on the comorbidities that you have and a one-page pro forma which will just say that you have this comorbidities, and if it's signed and stamped by that doctor, then you are automatically included into the list. So it's trying to be more inclusive rather than exclusive as far as people with comorbidities is concerned.
How do citizens register and where?
So registration, as far as I can understand, would be based on two things. One is data which will be uploaded onto the CoWIN app based on the electoral roll, which will give you the age group. And then if you still are not there on the electoral roll, you could go to one of the vaccination sites and upload your data onto the app with your photo ID card. It could be an Aadhaar card, it could be your driving license, it could be your passport. But if that shows that you are in the priority group, you would be accepted into the vaccination program, and you would get an SMS on your registered mobile number, and then you could select a site near your residence where you would want to get yourself vaccinated, and then it could be using an appointment system as you would do for booking a railway ticket in routine practice.
Doctor, what if a citizen is not tech savvy?
So if you are not tech savvy, you could go on to the vaccination site. So I think there are two things that are being looked at. One is that you could directly go to a vaccination site. You will have a walk-in also available. And if you are carrying your photo ID card, the site itself will help you to register, and you will get registered onto the app, and you will get yourself vaccinated. Your phone number will be recorded, and you will get a reminder message when you have to come for the second dose. There will also be healthcare workers and other volunteers who could help people, especially in rural India, to really go on to the app, or who could help people come to the vaccination site and get themselves vaccinated, because many elderly will not be able to come on their own. So you have to develop a strategy that they can actually be brought to the vaccination site, and a volunteer can help them get themselves registered, get themselves vaccinated, and then they could go back to their residence so that this could be facilitated.
Doctor, how many citizens are being targeted in this next batch?
So we are looking at as many as we can cover. The target always depends on how many people come forward to get themselves vaccinated. So the target would be something like maybe around 25 crores or maybe more than that. But a lot will depend on how many people come forward to get themselves vaccinated. I personally feel that we need to really develop a lot of aggressive strategy for getting public awareness and sort of getting over the infodemic, which is creating a lot of vaccine hesitancy. If you are able to vaccinate more and more people, then we could really prevent any surge in the number of cases, not only in Maharashtra, but in other states. And that is why we need to aggressively work on a program of getting more and more people vaccinated and getting people to come forward and get themselves vaccinated.
Where can citizens go to get vaccinated?
So now it's been opened up both for the government sector and the private sector. Many private hospitals which are part of the PMJ or are being covered will get registered, and they can therefore get the vaccine. The cold chain logistics will be worked out, and most of such hospitals already have facilities for storing the vaccine. The vaccine needs just an ordinary fridge, and if you can therefore have the facility to do it, you could become a vaccination site. And then based on the COVID app, vaccination could be given at that private or government hospital or center.
So would these hospitals acquire the vaccines from the companies or from the government?
I think that is being worked out. Possibly it will be through the government, and some mechanism of how the payment process is going to be done will also be worked out by the government. But I think it would be acquired by the government, and the government will distribute it to all the vaccination sites, whether they're in the private or the government sector, so that there is some accountability as far as doses is concerned, and there's no misuse of the doses in terms of the priority group not getting it and other people getting it, or it being sold in the black market, if I may put it that way.
Dr. Guleria, how much will vaccine shots cost?
So I think that needs to be worked out. I don't think we have a definite costing that has been done, but I'm sure it's not going to be very much, because the cost of the vaccine is not very high. It's only around 300 rupees, and many of the private sectors, hospitals have come forward and said they will charge only the basic minimum charge that they need for the logistics, and that could be just the cost of a syringe, a needle, and possibly some degree for human resources. This is more of I would say a social movement to really get out of the pandemic, which is useful for the hospitals also if they want to really come back and start having more and more patients coming in for routine procedures. So I think it will not be something which will be very costly.
All right. Can you get your second dose from a separate location?
You can. So I think one would like to really get people to get the second dose at the same site, but if you're traveling or if you're at a different place, using the COVID app, you could still get the second dose at a different site if that is available at that site and they have the doses on that site.
Will citizens have a choice of the vaccines that they receive?
So this is something that needs to be worked out. It will create a little bit of confusion. So each site will probably have a given vaccine. It could be either Covaxin or Covishield. And if you get yourself vaccinated there, then you will obviously get the vaccine which is available at that site. Giving too much of a choice may create a little bit of confusion. And remember, we still have an issue of supply versus demand. The supply is still limited as compared to the demand that we are seeing. And therefore, we will not really be in a position to have too much of choices currently. As things progress and we are able to match the supply with the demand, the choice will obviously be available and more vaccines will actually come into the market at that given point in time.
Okay. So that really is my next question. When will the additional stocks of vaccines roll out across India?
So there are two things. One is additional stock of the vaccines which are currently being made, and that is something which is happening on a regular basis. Both the companies are working on providing a continuous stock of vaccinations. But as we already know, Dr. Reddy's laboratory has also filed for emergency use authorization for the Sputnik vaccine. There is now published data of the efficacy of the vaccine, which is close to over 90%. And one is hopeful that in the coming few weeks, we will also have this vaccine available in the market. This will add to the number of vaccine shots available in India, which will be a big boost in terms of the absolute numbers.
Has Sputnik been cleared today, Doctor?
I'm not aware of that. That data will come out from the DCGI's office actually. But the meetings are being held and the data is being critically analyzed by the expert group.
All right, Dr. Guleria. So you've answered 13 questions. I meant to ask you 11, but thank you so much. Again, entirely in public interest. And we'll try and transcribe all your answers so that our viewers and our readers can actually understand so many questions coming to us. Thanks, Doctor.
Hello and welcome. You're watching Good Morning India. I'm Gargi Raut. Our top story, the vaccine drive will open up from Monday. Now, anyone above the age of 60 or above 45 years and with existing illnesses that makes them more vulnerable to COVID will be allowed to sign up to receive the coronavirus vaccines at government as well as private hospitals from the 1st of March. Doses at the government centers will be free while private hospitals will be allowed to charge for them. And NDTV has learned that it's expected to cost around 300 rupees per dose. NDTV's Sonal takes us through the details.
The biggest piece of news in all households across the country now is that finally it is our turn, and starting from the 1st of March, people above the age of 60 and those with comorbidities above 45 will be eligible for the vaccination. Also, this is the second phase. That means private hospitals as well have been given the license to do it, but in that case you will have to pay for the vaccine. But just about 4 days to go. That's pretty much what we know from the government about the rollout process. But don't get anxious. NDTV has spoken with top sources in the health department, and this is what we have gathered. First up, the cost of the vaccination. So currently the vaccine costs between 200 to 295 to the government. So roughly that's the range we are looking at after covering some overheads like syringes and human resource. The vaccines in private hospitals are likely to cost around 300 rupees. And also, like in the case of COVID testing, the government of India is likely to cap the pricing as well. So private hospitals can charge less than 300 rupees in cases but not more. Next up, who gets this vaccine? So if you are above 60, you automatically qualify. But for those with comorbidities above 45, sources tell us that deciding your eligibility will be a one-page medical document. One page that the government will make soon public to all of us, and it will have a list of 20 diseases. You simply have to tick yes or no, saying whether you fall in that severity category or the risk zone. And then you have to get that signed by a registered medical practitioner. Upload it on the app and your work is done. But how will you get the slot? When will your turn come? Well, for that, speaking with top sources, I figured out that they indicated that it would be something like booking a railway ticket. That means first come, first serve. And like you have to log in on the IRCTC to book your ticket, you will have to log in on the co-win app in this case. And since there have been several glitches reported in the past as well about the co-win app, walk-ins will be allowed. But so far we are told only if the jabs remain unused at the end of the day. Also, private hospitals will only get specific number of doses, and to ensure that there is no black marketing, no jumping of the queue, they will have to upload the details of the individuals that they are vaccinating on the CoWIN app. The government will then match it up with their own electoral list to get all those details. Now, registrations will begin once the CoWIN app is declared open, and the date of that is still awaited. And which brand of vaccine will you get? That crucial information the government currently not speaking about. On the whole, we are learning that this phase will be quite inclusive. So get your hints right there. Sonal Mehrotra Kapoor, NDTV.
And the vaccine drive opening up just as cases have begun to rise once again in several states. Maharashtra reported a significant jump in new COVID cases and fatalities on Wednesday, continuing with the rise that started around 10 days ago. A total of 8,807 cases, the highest in 129 days, was added in Maharashtra on Wednesday. Well, to talk more about the opening up of the vaccine drive and concerns regarding that, we're joined now by Dr. Rajesh Kumar, Executive Director, State Health System Resource Centre, Punjab, and Amulya Nidhi, National Co-Convener of the Jan Swasthya Abhiyan India. First to you, Dr. Kumar, it's going to be very interesting to see how, we're told from the 1st of March, it's going to open up for those over 60, those over 45 with comorbidities. However, the details are still awaited. You register on the CoWIN app, you can register on vaccination site apps, and, what do we know so far about the entire process?
I think the details will be spelled out very soon. And now country has experience of giving vaccine since 16th January. So immunization centers, CoWIN app, and all these procedures are now well tested, and people are very eager to get the vaccine. I think this is a very good opportunity, because this is the age group 60 plus where mortality is higher, and that is the way to vaccinate this population very quickly so that mortality can be reduced. And in the light of this emerging trend now, there is a spike in few of the states. I think the perception which was going on that COVID is out, I think that is not so. COVID is very much here, and vaccination is very important.
Absolutely, though the vaccination drive hasn't gone, as fast as we would have liked it to go, given the first phase, 3 crore were to be covered, and now the second phase is beginning. Amulya Nidhi, what are your concerns going forward? Because now it will also be very important for those, who are not tech savvy, but fall in that category to also get the vaccination. And for that, a lot of help also needs to be given.
See, the whole, if you see what is happening actually, I will just give you the background what is happening. See, vaccination, it's a pandemic, and if you want to vaccinate, you have to vaccinate 1.133 crores people in the country. So the way vaccination drive is going on today, if you see, there are two aspects. One thing about the whole situation of COVID and emergencies clause and all that things. The way vaccination drive is going on in emergency, it's not that kind of emergency situation. See, you have already approved the vaccine in emergency clause without the transparency in the data. And now if you see the result of the vaccination, the emergency, what is happening, without a proper monitoring system, vaccination drive has started. If you see the example of Madhya Pradesh, 1,37,000 mobile number of the healthcare workers is the same. If you see, more than 9,000 addresses are the same. So how you are going to monitor, because you are not able to monitor the adverse reactions, it's not been properly reported, as well as if you see, if the same number and same
these details about, this, we haven't really gone into the details of what you're saying regarding Madhya Pradesh about the vaccination drive. And so far, for our viewers, the vaccination drive has been open for healthcare workers and frontline workers. And yes, now from the 1st of March, it's going to be opened up for the second phase, which is or rather, if the third phase, if you want to call it, for those over 60 years of age. So here we're trying to focus on, how people will need help, will need a lot of, healthcare workers to be helping them in the entire process. And if it has to be done equitably as well, and, the pace has to be quickened up. You'll have private players as well. Finally, private hospitals also involved with this, as well as public hospitals.
See, the whole things at this present of situation of time, I think we need to develop a participatory model. The problem is that in the time of COVID also, and various stakeholders are giving their suggestion and try to participate. How we manage the COVID? In the COVID time, there was a participatory model, and there are lots of stakeholders are working to manage this pandemic. And it's also important to involve the participation of the common citizens. People's participation is important in the separate pockets. So there needs to be a proper developed plan. It's a participatory model, and where we can put out not only about the vaccination, but as well as how you can manage the COVID, how you can manage the pandemic. Now you are going into the next phase of increasing number of patients and increasing number of cases. So it's important to involve. There need to be a multi-central, multi-stakeholder meeting, multi-stakeholder coordination at the state level, at the district level. There are various besides the government is of course is in the front runner, and they are trying hard to manage it, but the system exists. The system, it shows also the system. There are, if you have a less number of healthcare workers, if you have a less number of regulatory officers, you are not able to manage. Then you also have a cold chain issue related to the supply chain management. So you need to involve all the stakeholders, not only it's not only from the awareness level, as well as about the transparency level, as well as from the monitoring level, as well as involve them in the decision making, as well the participatory model. So you need to have every 15 days and 10 days a multi-stakeholders meeting, and then we are able to manage this, because the way it is going on in the vaccination drive is very slow. If you can see from the first phase to second phase, why the number is not, we are not able to get on the 50%. So it's very important to develop a collective participatory approach at this point of time.
No, so absolutely. There needs to be more involvement, and yes, the vaccine drive needs to be a lot faster. Dr. Kumar, especially given that we've just, seen the cases coming down earlier, and at that time we needed to have more people being vaccinated. Now again, the cases are beginning to rise, and that's a big concern. What are the concerns that you have as the vaccination drive opens up, because in the first phase, surprisingly, we did see a lot of vaccine hesitancy, and because in the first phase you had healthcare workers and frontline workers being vaccinated. In the second, in this next phase from March, are you hopeful that more people will come forward and we'll see less of this hesitancy that we saw earlier?
Yes, I think now in this third phase, we are likely to see less hesitancy, because, in the initial phases, people were, had a policy of wait and watch, see their peers, colleagues, what kind of side effects they have. I think there is now this 1.5 month experience. And, we have seen in this frontline workers and health staff also, those who are in the senior category, those who are like more than 60, they were the ones who first came forward to get the vaccine, because they are at higher risk of mortality. So I see that in future, this in the third phase, because 60 plus people, they are more at risk of mortality. I think the response I expect will be better in the phase 3. But I think we need to accelerate. I think we agree on that. We need to accelerate. We have a network of health centers, and now since the vaccination centers are well functioning, and we have our grassroots level health workers who will help those who are not tech savvy, as registration has to be done. So there will be help provided to those who are not having telephones or computers. So they will be helped. So that is the plan.
All right. Well, clearly a lot of groundwork, needs to be done as we go into this third phase of the vaccination drive. Thank you so much, Dr. Kumar and Nidhi are there for joining us to talk about, the concerns and what needs to be done as we open up the vaccines for the rest of the country, for those over 60 and over 45 with comorbidities.
That's the only concern. It has to be free to all. That's not to be doses. I feel the COVID treatment and vaccine should be free to all, and also with the monitoring of the private sector.
For those who want to pay can go to the private doctors, private hospitals, I beg your pardon. And so that is something also that is being balanced. So we'll wait and see as more details are made available by the government. Thanks so much for joining us on the show today. With that, time for us to slip into a short break. We'll get you more news updates on the other side. Stay with us. Welcome back. Now, court in London will today pronounce its verdict on the extradition case that India has filed against fugitive Nirav Modi. The luxury jeweler has been in jail in London since March 2019 following an arrest after an Interpol notice was issued in the Punjab National Bank scandal termed as the nation's biggest bank fraud. He fled the country days before news broke of PNB reporting of fraud to the tune of 14,000 crore by Nirav Modi and his family members in connivance with some bank officials in Mumbai. On behalf of PNB, officials in question fraudulently issued letters of undertaking during the year 2011 in favor of Nirav Modi without following due process. The CBI and Enforcement Directorate have charged him of money laundering and have been pressing for an extradition for investigation to India. Today, that decision will be announced by the court. Now, Bengal election news and same place, same ground. Mamata Banerjee addressed an almost equal crowd in Hugli's Dunlop estate where Prime Minister Modi had addressed a rally on Monday, and both leaders raised the pitch.
Modi versus Mamata. Both leaders addressing rallies at the same ground just 2 days apart, both on the offensive. He had attacked the Trinamool government for tolabazi or extortion. Mamata Banerjee took the bull by the horns, slamming the BJP for the CBI visit to her nephew Abhishek Banerjee's house on Tuesday to question his wife.
কিন্তু বলুন তো মা বোনেরা আমার একটা মা বোনেদের অসম্মান করতে পারেন আপনি আমার বাড়িতে ঢুকে গিয়ে একটা বাচ্চা মেয়ে 22-23 বছর বয়স একটা বউ ঘরের কন্যা ঘরের বউ তাকে কয়লা চোর বলছেন আর কয়লা চোরদের নিয়ে নিজে পড়ে তুলে বেড়াচ্ছেন
More pot shots at the Prime Minister and the Home Minister. Demons, she called them, and lampooned them with Bengali words that defy translation but are not flattering.
এই দেশে দুটো নেতা এই দেশে এখন দুটো নেতা একটা নেতা হচ্ছে হদল কুতকুত আর একটা নেতা হচ্ছে কিম্ভুত কিমাকার
Among supporters of both parties, the polarization is hard to miss.
তৃণমূল আসার পরে প্রতিশ্রুতি দিয়েছে কোনো কাজ করেনি আবার নতুন সরকার দেখি বিজেপি সরকার কিছুক্ষণের মধ্যেই শুরু হবে প্রধানমন্ত্রী নরেন্দ্র মোদি কাজ করবে নিশ্চয়ই
মোদিজির নেতৃত্বে বিজেপি বিধানসভায় ভালো আসন পাবে এবং বিজেপি সরকার গঠন করবে
এটা বলে দিচ্ছি আমি বিজেপি ভাবে নন বেঙ্গলি যে আছে তাদের সাথে আছে এবার আর নয় বিহারি হোক তেলুগু হোক আপনার ছত্তিশগড়ের লোক হোক কেউ এবার ওনার সাথ নেই এবার আমরা দিদির সাথেই আছি
দেখুন এখানে অনেক কিছু আছে এর মধ্যে অনেক কিছু মানে ভুল ত্রুটি আছে কিন্তু তা বলে যে দিদি পিছিয়ে পড়বে এটা নয়
Speaking before an equally large crowd, Mamata Banerjee took on the Prime Minister, attacking him and Amit Shah. She addressed the same issues with her slogan, Khala Hobe, and she warned the people of Bengal that BJP was an enemy of Bengal. Also telling the crowd that while there have been problems earlier in this district for her party, this time around Hugli should return to the Trinamool. In Hugli, with camera person G.D. Shankar, Saurabh Gupta, NDTV.
Time for us to slip into a short break. Coming up on the other side, we'll tell you about the Prime Minister's program in the South. The COVID vaccination drive will open up for those over 60 years and for those over 45 years with comorbidities from Monday. Vaccines will be available at both government and private hospitals. NDTV has learned vaccines in private hospitals will cost around 300 rupees per dose and registration will be on the CoWIN app as well as vaccination sites. This as cases in the country are on the rise. Maharashtra sees the highest spike in daily cases in 129 days with 8,807 new cases added on Wednesday. A UK court will decide whether jeweler Nirav Modi, wanted in the 14,000 crore Punjab National Bank scam, will be extradited to India. At her latest rally, Bengal Chief Minister Mamata Banerjee hits out at the BJP and targets Prime Minister Narendra Modi using terms like Dangabaaz and demon. On day 3 of his campaign in Kerala, Rahul Gandhi swims with fishermen while the BJP attacks him, accusing him of divide and rule politics for his remarks on voters in the south compared to the north. And day 2 of India versus England test in Ahmedabad, India look to solidify their innings. Prime Minister Narendra Modi will visit Tamil Nadu and Puducherry today at around 11:30 a.m. The Prime Minister will inaugurate and lay a foundation stone for various developmental initiatives in Puducherry, and then later at 4 will be the program in Tamil Nadu. Let's go across to Uma Sudhir now for more details. And Uma, interesting, the Prime Minister's Puducherry visit coming soon after the government has fallen there. Tell us more about his program.
Yes, as you mentioned, 11:30 is when he's going to be inaugurating a slew of, in fact, development measures in Pondicherry, in Puducherry itself. And yes, it comes at a time of political turbulence and in a week when, in fact, the Congress-led government, coalition government of Narayanaswamy, in fact, was forced to resign and had, in fact, blamed the BJP for the fall of his government there. But BJP certainly going all out there. They had no presence at all in Puducherry, but they are hoping either through the president's rule or through the coalition government that they will have a bigger political presence in Puducherry and are certainly hoping to be part of the government after the elections in May. And a similar kind of a story, if I should say, in Tamil Nadu as well, where the Prime Minister will be, in fact, flying into Coimbatore, where the big focus really is on Coimbatore. As you know, after Chennai, Coimbatore is the biggest of the metros, of the cities in Tamil Nadu, and it is, in fact, a textile capital, very often called the Manchester of the East, also an automobile capital and a huge industrial belt where, in fact, the BJP sees a lot of political opportunity, and that's the reason why we are seeing over 12,400 crore rupees worth of infrastructure projects which are going to be inaugurated by the Prime Minister there. There's things ranging from development initiatives, welfare initiatives, including Prime Minister's Awas Yojana, about 4,000 tenements to the less privileged sections. You're talking about irrigation projects, the highway projects. There are infrastructure projects of all hues, including the ports there that are going to be the focus. And post that, we are going to have the Prime Minister address a public meeting in Coimbatore itself. Of course, as I mentioned, rather than a Chennai, it's the Coimbatore, the belt that the BJP, it appears, would be focusing on, because an internal assessment of the party seems to reveal that more electoral gains and are to be made in that particular belt, and therefore the focus likely to be there. Of course, security also hugely tightened. Of course, COVID protocols also going to be followed, because in that place where Codicea, where the inauguration of all these projects is to happen, there as well COVID protocols and the testing being done to ensure that at a time when we are talking about a second surge happening, this does not lead to any kind of a situation like that. But yes, Coimbatore also has had the history of about 23 years ago when L.K. Advani was there for a meeting. There were bomb blasts, series of, in fact, 12 bomb blasts that led to killing of 58 people, and it was thought to be a conspiracy against the BJP leader. And therefore, that's a belt where those kind of concerns are also huge, and therefore security is going to be quite huge in a public meeting that is expected to be attended by over 1 lakh people. Back to you, Gargi.
All right, Uma, so the Prime Minister in South India today, and the Home Minister will be in the Northeast today. Let's go across to Ratnadeep for more details on Amit Shah's visit. And Ratnadeep, this is his third visit to Assam.
That's right. This is his third visit to Assam this year, and in fact, the election dates would be declared anytime soon, and in fact, the polls are due in Assam, and that's why both Prime Minister Narendra Modi has visited Assam already thrice, and this time Amit Shah is on his third visit today. His visit is to numerous places. In fact, he's going to address 2 public rallies apart from attending 2 different socio-religious events, but the focus would be his visit at Battleground. Now, Battleground is a place which is the birthplace of Shriman Shankar Dev, the greatest Assamese social religious thinker, reformer, and the BJP-led government in Assam has decided to start a project of 188 crores for the beautification of the Battleground, the monastery at his birthplace, and to give it a facelift. In fact, the BJP would go on to show this as as an example of its promise of how it is trying to protect and promote Assam's indigenous culture, traditions, social beliefs, the thinkings of the social reformers. So in a way, Shriman Shankar Dev, who is greatly revered across Assam among the Assamese people, the BJP somewhere trying to use him as their poster boy. However, the party claims that this has nothing to do with politics and it's a government event, but one would expect that this would create a lot of optics for the BJP as well as ahead of the elections. Remember, this is also a place where the Bengali Muslim votes are the determining factors, and last time due to division of votes between the Congress and the AIUDF, the BJP candidate had won. But this time, the Congress and the AIUDF have formed a grand alliance. So, Battleground in a way is a place where the BJP and the grand alliance would have a tough fight.
All right, Ratnadeep, thanks so much for joining us with those details. So, Home Minister Amit Shah will be in Assam today. Now, let's get you more on the vaccine drive, which will open up from Monday. Anyone above the age of 60 or above 45 years and with existing illnesses that makes them more vulnerable to COVID will be allowed to sign up to receive the vaccines at government as well as private hospitals from the 1st onwards. Doses at the government centres will be free, while private hospitals will be allowed to charge for them. NDTV has learned it's expected to cost around 300 rupees per dose. Sonal gets us the details.
The biggest piece of news in all households across the country now is that finally it is our turn, and starting from the 1st of March, people above the age of 60 and those with comorbidities above 45 will be eligible for the vaccination. Also, this is the second phase. That means private hospitals as well have been given the license to do it, but in that case, you will have to pay for the vaccine. But just about 4 days to go. That's pretty much what we know from the government about the rollout process. But don't get anxious. NDTV has spoken with top sources in the health department, and this is what we have gathered. First up, the cost of the vaccination. So currently, the vaccine costs between 200 to 295 to the government. So roughly, that's the range we are looking at after covering some overheads like syringes and human resource. The vaccines in private hospitals are likely to cost around 300 rupees. And also, like in the case of COVID testing, the government of India is likely to cap the pricing as well. So private hospitals can charge less than 300 rupees in cases, but not more. Next up, who gets this vaccine? So if you are above 60, you automatically qualify. But for those with comorbidities above 45, sources tell us that deciding your eligibility will be a one-page medical document. One page that the government will make soon public to all of us, and it will have a list of 20 diseases. You simply have to tick yes or no, saying whether you fall in that severity category or the risk zone. And then you have to get that signed by a registered medical practitioner. Upload it on the app and your work is done. But how will you get the slot? When will your turn come? Well, for that, speaking with top sources, I figured out that they indicated that it would be something like booking a railway ticket. That means first come, first serve. And like you have to log in on the IRCTC to book your ticket, you will have to log in on the co-win app in this case. And since there have been several glitches reported in the past as well about the co-win app, walk-ins will be allowed. But so far we are told only if the jabs remain unused at the end of the day. Also, private hospitals will only get specific number of doses, and to ensure that there is no black marketing, no jumping of the queue, they will have to upload the details of the individuals that they are vaccinating on the co-win app. The government will then match it up with their own electoral list to get all those details. Now, registrations will begin once the co-win app is declared open, and the date of that is still awaited. And which brand of vaccine will you get? That crucial information the government currently not speaking about. On the whole, we are learning that this phase will be quite inclusive. So get your hints right there. Sonal Mehrotra Kapoor, NDTV.
Well, let's now go across to Sukirti for more. And Sukirti, so this was the very, very exciting news yesterday when, it came out that the vaccine drive will open up for all from the 1st of March. But still a lot of details that people want to know. As Sonal was explaining there, you can possibly register on the CoWIN app once it is opened up. There will also be other sites. There will also be challenges for those who may be, a little technically challenged. So what are you hearing about the entire process?
Well, yes, more clarity is still awaited from the Health Ministry, and it is expected that they will hold a press conference either today or tomorrow to give out further details on this entire process. But like you mentioned, this is of course a concern among the public that people who are not tech savvy, especially because these are senior citizens, people who cannot operate the mobile application or the website, how will they end up registering? So far what we've been getting from the government officials is that the government will try to come up with multiple mechanisms. One, of course, for those people who they can carry out the self-registration on the application and the website. But for those who are unable to do that, there would be certain list of officials that would be given to them that you can approach a district level or a block level official or your nearest public health official, and they will help you, they will assist you in getting your registration done and how to upload the documents, how to fill up your details, what are the details that you have to give to the physician, what is exactly that you need to get signed from him as a medical certificate. So all of those details, and of course more confirmation on how much is it going to cost if you go to a private hospital, all of that is still awaited. So people definitely looking forward to it, but of course very few days left now for the vaccination process to begin. Today is already Thursday, Monday we are set to begin the process. So about in a day or two we are expected to get proper details from the Health Ministry.
All right. Thanks so much, Sukirti, for joining us with all those details. And with that, time for us to slip into a short break. On the other side, we'll get to the latest on the India-England match.